The topic I chose for my intervention project is discrete trial training. This quick presentation will cover what it is, who and why it was developed, the hypothesis and outcome, its uses in expressive and receptive language, and why it is an evidence-based practice. Discrete trial training is a one-on-one instructional approach which the learner is presented with repeated trials paired with the purposeful use of antecedents and consequences. When discrete trial training is first implemented, the trial begins with the teacher presenting a student with a stimulus or direction and immediately prompting the correct response. If the student answers correctly, they are rewarded with an antecedent of their choice as to ensure it is reinforcing to learning. Once the student begins to beat the prompt and respond independently to the stimulus, the teacher adds a time delay. In other words, after the stimulus is presented, the teacher may wait 5 seconds before prompting the correct response. If the student is correct, they are reinforced with an antecedent that has proven to be reinforcing. But if the student answers incorrectly or no response, an error correction procedure should occur, followed by re-presenting of the stimulus with either a prompted or independent response. Who and why was discrete trial training developed? Discrete trial training was first introduced in the early 1970s by Dr. Levis, who was working with nonverbal, institutionalized individuals with autism spectrum disorder as a way to increase verbal and communication skills. It has been the focus of many research studies and has been accepted as an evidence-based practice for children with autism under the age of 11, but has seen success outside of that age range. The hypothesis of this intervention is through the use of known reinforcement and chunking of a task while discretely teaching each part of that task, a student will increase his knowledge base of the target topic. When discrete trial training is implemented with validity, the student will have gained a solid understanding of the target topic. Discrete trial training has been shown to increase students' ability to identify and express emotions in varying situations. As we know, expressing one's emotions as well as identifying others' emotions is a skill that does not come easy to many students with disability, especially those with autism spectrum disorder. In addition, discrete trial training has been used to teach students how to label or tag items, which has been shown to increase their ability to request or demand items that are wanted or needed. A way in which discrete trial training can support language is through the increase of spontaneous responses, or response that is present in the absence of adult vocalizations. According to the National Professional Development Center on Autism Spectrum Disorder, discrete trial training meets the evidence-based practice criteria within the early childhood and elementary age groups for promoting the development of communication and language, adaptive behavior, cognitive and academic skills, social and play skills, and for reducing interfering behaviors. Further research has been conducted by authors such as Jones, who conducted a study on spontaneous speech, McHugh, who did research on emotions in situations, and Kodak, who did their research on mand and tact.